Good morning, ladies and gentlemen, or good afternoon from Berlin. My name is Axel Klaphake. I work with GIZ. I'm the Director for Economic and Social Development and Digitalisation in GIZ headquarters. German freight manager DHL tells us that 200,000 pallet shipments and more than 50 million deliveries in cooling boxes are required to provide global coverage of COVID-19 vaccines. That equals to more than 15,000 flights across the world. The scope of this endeavor is obviously immense and requires a well-coordinated approach with all stakeholders involved. Consequently, your conference, of course, couldn't be more timely, and I'm very happy to join the discussions with this pre-recorded statement. GIZ, the organization I'm representing, is, I think many of you might know GIZ already, is the federal German organization for international cooperation, a service provider. Our main commissioning party is the German government, in particular the Federal Ministry for Economic Cooperation and Development. But we have also projects that are directly commissioned by private sector parties. We have a good example in Ghana, where we implement with Bayer, the company, the so-called Ghana Heart Initiative in the health sector. With the corona crisis, we see also in the German system, in the German Development Cooperation system, new interest, a returning interest in health issues. The German government in particular wants to contribute to strengthening health systems in Africa. And currently, as GIZ, we are very proactively engaged in shaping future activities and in designing new projects. And I'm very happy to join and to share with you now a few thoughts and to invite you also to join us in this endeavor to develop projects and to eventually implement those. The corona crisis, I think, shows us that we'll have to marry specific aspects in a concerted approach of development cooperation, which previously have been tackled rather in an isolated way. This is the connection between, first, the provision of essential health care, like vaccines, secondly, logistics and the empowerment of steady supply chains for consumables, for example, and thirdly, networks of key stakeholders whose interests and abilities we can combine and leverage. Let me say very few words about the current status of German engagement in the health sector in Africa. So we are focusing on strengthening health systems in a variety of countries. We also, of course, have very significant contributions to the multilateral mechanism in the health sector, and in particular when it comes to vaccine production and the provision of vaccines to the respective African countries. This multilateral engagement is of pivotal importance through well-known multilateral mechanism and funds like Gavi and others, but we also, of course, directly cooperate and contribute to other organizations such as the World Health Organizations and African organizations, of course. In the past 15 years, the German government has increased its annual spending on health from $0.6 billion to more than $1 billion annually. A very big focus has traditionally been in, as I said, the cooperation with multilateral organizations. In response and in the aftermath of the Ebola crisis in the year 2014 and 2015, Germany, and it's now being implemented by GIZ, has also installed a rapid response approach, a rapid response team, which we are still and very successfully operating on behalf of the German government. And we had this year different missions from this rapid response team, also in different African countries such as Namibia or Togo, just to mention two. I can also happily report that the German government has recently launched a new global health strategy, which is being backed and agreed upon by the whole German government and the whole cabinet. And it shows that the German government wants to develop activities to do with the global health strategy in 5 priority areas. starting from strengthening human health, prevent diseases. Secondly, tackling environmental challenges, climate change and health holistically. So this is the One Health approach we are trying to push forward. We thirdly want to strengthen health systems globally. Fourth, we want to tackle cross-border health threats such as pandemics. And fifth, increasing efforts we want to develop in health research and innovation. For Germany, the provision of health-related services, hardware, consumables and pharmaceuticals also play a major role for the German economy. Especially interesting for this conference, the export of pharmaceuticals from Germany make up more than 50% of all health-related exports. Let me briefly take a snapshot on GIZ activities in strengthening global health. In the field of health, we manage currently a global portfolio of around 150 million euros. That is only the bilateral share. On top, we add multiple activities cooperating with the private sector. We see the cooperation in general with the private sector as essential in reaching the Agenda 2030, the Sustainable Development Goals. With the private sector, we can indeed leverage private capital and increase impacts together with our partners in our partner countries. In 2019, we have here in Berlin, where I am currently, set up on behalf of the German Ministry for Health, the Global Health Hub, a networking and exchange platform for all stakeholders working in global health. This hub bundles and facilitates knowledge exchange and ideas and initiates cooperation between the public and private stakeholders involved internationally and multilateral organizations. One project, I've mentioned that already, but we are very proud of this, as this shows also the potential of cooperating with the private sector from our perspective, is the so-called Ghana Heart Initiative, which we implement in collaboration and commissioned by the German pharmaceutical company Bayer. The goal of this project is to improve risk assessment and management of cardiovascular diseases in public health facilities in Ghana. Those three areas of engagement depict very well what we as GIZ aim at and can bring to the table. Decades of experience in strengthening health systems in partner countries, a robust focus on employing networks for reaching impacts, and a very strong conviction that we can only be successful incorporating the private sector in our activities. So what does it mean now? The current situation with regards to COVID, the current discussion about production and distribution of vaccines. What does it mean currently in more concrete terms in our discussion in between the German partners and our private sector partners as well? Currently, of course, large parts of Africa could not yet readily be supplied at scale due to a massive lack of cold chain logistics capacity. Existing medical supply chains usually distribute vaccines at 2 to 8 degrees Celsius. The controlled temperature transport of COVID-19 vaccines, though, is a major challenge, as some of them will need to be kept at very low temperature of, as we all know, or as we have all learned during the last couple of weeks and months, around up to minus 70 degrees Celsius. The necessary logistics solutions depend, of course, on those temperature requirements, transport distances, and volumes, as well as factors related to costs, lead time, warehouse capacities, and of course the management skills of staff to manage those warehouses, and the availability of packaging and equipment. Public health systems have found solutions for this before, at least partly, especially during the Ebola crisis with ultra-cold storages. However, ultra-cold freezers in large cities would still need to be developed to store the vaccine before it was distributed and to chill the cold packs used. Especially in areas where access to electricity is unreliable or missing altogether, it would be very difficult to provide enough health facilities with the required refrigeration capacity. So the cooling aspect, of course, and the logistics aspect is certainly also an area GIZ could perfectly think of contributing to through our long-lasting experience in different African countries for example, also solar powering health stations. We should jointly think about how to tackle the new challenge regarding logistics and transportation of COVID vaccines to guarantee stable refrigeration capacity. Safeguard will need to be put into place, protecting supply chains from theft, and to find solutions that help supply chains to be protected from substandard and falsified vaccines entering markets. So even the regulation aspect is a very important one when it comes to vaccines in the African countries. So in addition to that, we also observe challenging situations in local staff capacities. So many communities in partner countries still lack healthcare professionals that would be perfectly able to administer vaccines. Also, there's a shortage of qualified personnel being able to handle vaccines properly by keeping them, as I said, extremely cold. Most national vaccine distribution systems are not designed for this challenge, for those large-scale adult vaccination programs, which could pose additional challenges. So let me summarize and come to an end, and let me conclude. Before COVID, vaccines will be available for the broad population all over the world, and especially in Africa, we will still have a couple of months. So countries and logistic chains can still be prepared, and we can still jointly design support to those programs among all players that will have a role to play here, in particular, of course, the multilateral mechanism. And I understand that quite a few of those organizations are being present at this conference here. And we see, of course, also the strong mandate of multilateral organizations in this realm here. But I think we are also willing and also able to contribute to those discussions and also to the eventual implementations. How can we ensure a supply of COVID-19 vaccines, and how can we sustainably impact health systems making use of this momentum, possibly preparing for pandemics which are still lying before us? So this is the aspect even of sustainable supply chains for vaccines. It is certain that governments and NGOs and all players all together need to improve infrastructure and collaborate closely with the vaccine producers and logistics providers. Appropriate partnerships with the whole supply chain and projects on the ground will play a key role. GIZ is constantly looking for partners, I've mentioned this already, in jointly implementing concrete activities which would strengthen partner countries in Africa and at the end benefit people on the ground. Thank you very much for your attention, and I wish you very fruitful discussions. Thank you.